You can't see a concussion. A concussion happens when the brain bangs against the skull, and it can happen even if there was no direct blow to the head. Mild concussions may not even show any symptoms you can recognize. So how do you identify a concussion when one occurs? First things first. The brain banged against the skull. That's going to hurt. If you see an athlete take a blow to the head or body, and then press a hand to their head as if in pain, a concussion is likely. If a player gets hit in the head, or says their head hurts at any point, get them out of play. If a player is knocked unconscious, get them to the hospital immediately. Once you've got them off the field, check for the classic symptoms of a severe concussion first. One pupil larger than the other, a headache that gets worse over time and won't go away, weakness, numbness, or lack of coordination anywhere in the body, drowsiness, nausea or vomiting, slurred speech, inability to recognize people or places that are familiar to him, confusion, restlessness, or anger, any sort of unusual, out-of-character behavior. These symptoms mean your player needs medical attention immediately. They may not crop up right away, so keep an eye out on your athlete over the next day or so. If any of these symptoms show up at any time, get your athlete to a doctor. Some more mild symptoms of a concussion are a headache, slight vision problems, needing to sleep more than usual, being particularly sensitive to noise and light, and having trouble concentrating or thinking clearly. If any symptoms seem especially severe, don't hesitate to go to the doctor. Next, check out our treatment video to learn how to safely manage a mild concussion at home. Want to keep your child's head safely in the game? Learn more about how to prevent, identify, and treat a concussion. Visit www.concussionmg.com. Want to keep your child's head safely in the game? Learn more about how to prevent, identify, and treat a concussion in our special free 3-part PIT Concussion Guide video series by visiting www.concussionmg.com.